Ontario nurses are helping to shape the future of healthcare in Canada. They joined with registered nurses and health professionals from across the country to call on all Canadians to vote for care in the 2015 federal election. Canada's previous federal government allowed their health accord with provinces to expire and introduced changes to healthcare funding that would result in $43 billion in cuts over the next 8 years. These cuts would mean fewer home care visits, fewer primary care centers, fewer long-term care beds, and fewer nurses providing frontline care. As patient advocates, nurses organized for change. We talked to our coworkers and neighbors. We hosted healthcare debates. We amplified our voices on social media. We wrote to local newspapers, and we called on all candidates to commit to action. Nurses have 4 priorities for better care: adequate public funding for universal health care, a health human resources plan to hire more nurses, a national pharmacare program so everyone can afford the medications they need, and a safe senior strategy to care for our aging population. On October 19th, Canadians went to the polls. From coast to coast, we voted for change. An overwhelming majority voted for parties that had committed to improving healthcare. Canada's new federal government has committed to negotiate a new health accord with provinces that defends the right of every Canadian to timely, publicly funded healthcare. Work with provinces to improve access and reduce the costs of prescription drugs. Expand mental health services for Canadians, including veterans and first responders. Allocate $3 billion for home care and $20 billion for social infrastructure, including investing in seniors' facilities. These commitments are a big step forward for better care, but there's still more work to be done to build strong support for nurses' priorities. Canada's registered nurses and allied health professionals will be working with stakeholders to forge a united vision for a new health accord. Talk to your neighbors and representatives about the future of Ontario's healthcare. As the workers delivering frontline care each and every day, let's ensure our voices are heard.